بسم الله الرحمن الرحيم. السلام عليكم. هنبتدي في المحاضرة الثالثة بتاعتنا our third lecture اللي هي is dealing with a large group of gram-positive cocci اللي هي ال Streptococci. Our last lecture كنا بنتكلم عن الستافيلوكوكاي اللي احنا قلنا كانت في الجروب اللي هو Pyrogenic invasive gram-positive bacteria. فبرضه هنا ال Streptococci هي تبع نفس المجموعة. These streptococci are a large group of gram-positive cocci that grow in pairs or in chains. يبقى هنا الارينجمنت هتختلف بقى بعد ما كانت كلاسترز في حالة الستافيلوكوكاي. هنا هنلاقي ان الارينجمنت بتبقى على شكل زي السلسلة in chain long chain زي ما انتم شايفين كوكاي، يا اما only in two cells together زي ما هنشوف في ان شاء الله في الستريبتوكوكس نيموني المحاضرة الجاية ان شاء الله. Most streptococci are facultative anaerobes. يعني احنا دايما بنعمل عملية comparison between the last lecture with this lecture. فال last lecture قلنا برضو it is facultative anaerobic اللي هم الستاف. هنا برضو it is facultative anaerobic but some are obligate anaerobes. We can differentiate between it and between staphylococci in being catalase negative. Although it is aerobic, بس ال streptococci is characterized by catalase negative. That is to say, it doesn't produce this enzyme that بتعمل ايه اللي هو الكاتاليز زي ما قلنا اللي هو بيكسر الهيدروجين بيروكسيد to oxygen and water. فهنا التست ده بيبقى نيجاتيف ودي حاجة very characteristic أفرق بين الستاف والستريبتوكوكاي. And they don't reduce النيتريت. Streptococci are very demanding in their growth requirements. They ما عندهمش القدرة this organism to synthesize many of these nutrients وهم محتاجين ل nutrients كتير for their growth. So they must be grown artificially in an enriched media. زي ايه؟ زي البلاد agar. يبقى دايما الستريبتوكوكاي برضو is different from the staph. Staph قلنا it can be grown on routine media, nutrient agar, but streptococci must be grown on blood agar. يعني من ضمن الحاجات برضو ان البلاد agar بيبقى فيه كاتاليز انزيم. فالكاتاليز انزيم ده بيحمي الاورجانيزم من ايه؟ من الهيدروجين بيروكسيد produced after the aerobic metabolism. In streptococcal classification, actually there are two types of classification and both are important. The first classification, which is the earliest system, known as hemolytic classification, is used to classify streptococci based on their ability to lyse erythrocytes اللي هي موجودة فين؟ اللي هي موجودة on the blood agar on which they are grown. As we see this plate, blood agar plate. ففي عندنا three groups of this type of classification. بيقسم الستريبتوكوكاي إلى three groups. Number one, alpha hemolytic. Alpha hemolytic, these produce partial hemolysis when this organism oxidizes the hydrogen peroxide. اللي احنا قلنا الهيدروجين peroxide ده بيبقى موجود فين؟ في الإريثروسايت hemoglobin, resulting in a greenish brown discoloration around the colonies. As you see here in the picture, this of course it is cultivated as the shape يعني alpha. بس طبعا الأورجانيزم ما نماش بالمنظر ده هو الستريكينج عملوه بالشكل ده عشان يبين لك اللون the color of the alpha group اللي هو بيبقى ايه greenish brown discoloration. الاكزامبل الفيريدنس تايب، وكلمة فيريدنس يعني green، فعشان كده المجموعة دي بيسموها الفيريدنس تايب لأنها بتدي الجرين discoloration على الأجار البلاد أجار. وعندي كمان اكزامبل الستريبتوكوكس نيموني. الجروب الثاني بيتا هيموليتيك streptococci, they produce complete hemolysis due to the extracellular streptococcal enzymes اللي هي الستريبتولايزنز اللي هنتكلم عنها طبعا النهارده causing production of clear zones around the colonies. Example is Streptococcus Pyrogenius. As you see here, this beta group عملت ايه؟ did complete hemolysis للبلاد، فواضح ان البلاد بقى لونه يالو يعني حصل complete hemolysis. And finally gamma hemolytic group, this cause no hemolysis. Here is the gamma فهنا no hemolysis خالص occurs on the blood agar. The second classification called Lancefield group classification. الاسم لانسفيلد بيرجع للعالمة الساينتست اللي هي واحدة ست اسمها ريبيكا لانسفيلد. She did this kind of classification in the year 1933. Accordingly, Streptococci could be differentiated by carbohydrate antigens. Present in these carbohydrate antigens, they are present within their cell wall. And they call them C carbohydrates. They give them the letter C, carbohydrates. Many of these carbohydrates are teichoic acids. And they could be identified using type-specific antibodies. يعني test, agglutination test is done to different عشان يبين this group of organism. فعندنا they can divide them into 21 groups of this C carbohydrates are identified and they are given the letters from A to U. طبعا باين هنا في البيكتشر ان في عملنا عملية الاجلوتينيشن between the organism واللي هو السي كربوهيدرات بيتفاعل مع ال type specific antibodies. فطبعا it is clear that this sample is group A لأن حصل agglutination with the A antibody. Each group has a more or less specific habitat. يعني ممكن يتواجد في مكان معين. Is present in a certain place. For example, here we can see Streptococcus pyogenes and all these species we are going to deal with inshallah. Streptococcus pyogenes, this is Lancefield group A and hemolytic group beta. That means it is complete, بتعمل complete hemolysis لل RBCs and it is من ال C substance, it is تحت group A. دي موجودة normally as an upper respiratory tract normal flora يعني موجود normal habitat of the upper respiratory tract وال disease caused by this pathogen is the major, it is a major human pathogen وهنتكلم فيها كتير لأنها بتسبب many different diseases. Streptococcus pneumoniae, here it is this mark absent or variable. فالLancefield group may be absent, and that is to say they doesn't possess a C carbohydrate substance on their cell wall, or it is different, okay? So it is variable. Hemolytic group, it is alpha, that means partial hemolysis, present also in the upper respiratory tract, and it mainly causes pneumonia, meningitis, and otitis media. Streptococcus salivarius, برضو it is Lancefield group يا إما absent or variable. It's alpha hemolytic, present in the mouth as a normal flora of the oral cavity, and it causes subacute bacterial endocarditis. Streptococcus mutans, برضو Lancefield variable or absent, alpha hemolysis, and it's present also in the mouth, and this is the cause of dental caries. Enterococcus fecalis, we call it Enterococcus, although it was first known as Streptococcus fecalis, but as it is always present in the GIT of human and animal, they changed the name of its genus to Enterococcus. So it is called Enterococcus fecalis. Lancefield group D, gamma hemolytic, that is to say it doesn't cause hemolysis. GIT of human and animals, and it also can cause subacute bacterial endocarditis and also is involved in nosocomial infections. واحنا برضو جبنا سيرتها لما اتكلمنا في الستاف انها بتسبب الامراض اللي هي بتبقى ناتجه عن stay in a hospital. So it is also one of the organisms, the top organisms causing nosocomial infections. And finally, Streptococcus lactis, it's group N, Lancefield group, gamma hemolysis, no hemolysis, is present in the dairy products and it's causes souring of milk and it is never pathogenic. So we're going to deal with all these strains except طبعا Streptococcus lactis, it is not pathogenic, so we're not going to deal with it. First, we're going to take the viridans group اللي هي Viridin Streptococci, which is no Lancefield group as from the table we saw it, and it is alpha hemolytic. احنا شفناها في التيبل اللي فات انها no Lancefield group and it is alpha hemolytic or variable زي ما قلنا. Its nomenclature Streptococcus Salivarius, and the word Salivarius comes from saliva. So this helps us to know that it is usually existing in the mouth. كلمة Salivarius coming from the word saliva اللي هو اللعاب. So it is normally found in the oral cavity and the nasopharynx. It doesn't produce acute infection but acts as a secondary invader. امتى بيحصل انها تتحول الى parasite او parasitic وتسبب مشاكل؟ After dental operation such as tooth extraction, it finds its way into the bloodstream. بتلاقي طريقها انها تخش الى البلد بعد ما يحصل اي عملية في الاسنان. Normally the organism is removed within 10 minutes. على طول الجسم هيتخلص من اي organism دخل البلد within 10 minutes هيحصل له phagocytosis and مش هيبقى فيه any problem. But it may settle on abnormal heart valves. يبقى إذا لو كان بقى الهارت فيه مشكلة و is abnormal هنا هيحصل المشكلة. عشان كده سميناها secondary invader. يعني لازم يكون في problem in the heart موجودة قبل ما يحصل this kind of infection. ايه الابنورمال هارت فالفز like ايه؟ like congenital يعني تبقى حاجه وراثيه، شخص عنده حاجه وراثيه عيب خلقي in his heart، or acquired vulvar disease. زي ايه الاكوايرد vulvar disease؟ زي مثلا الروماتيك فيفر. And by this it can set up بقى a subacute bacterial endocarditis. The symptoms include fever, heart murmurs, enlarged spleen and anemia. طبعا fever مفهومة. We want to understand this heart murmurs. This heart murmurs actually is a sound, is a murmuring sound. بالعربي اسمها لغط في القلب. ده عادة بيحصل في حالات الاندوكاردايتس. كلمة endocarditis that means the involvement of the inside of the heart. The inside lining of the heart ايه اهم حاجة present in the inside of the heart? The valves. So always the word endocarditis will mean the involvement of the valves of the heart. إن حصل inflammation in the valves of the heart. نتيجة this inflammation, due to this inflammation, the blood may change its direction. You know the valves مفروض it's lets the blood move in one direction from the auricles to the ventricles. Or فلما بيحصل بقى this infection in the orifice in the valves, the blood can change its direction. دي أول حاجة. أو due to the thickening and the adhesions اللي نتيجة inflammation. The inflammation makes adhesions and thickening of the heart valve, so the blood can't move easily through the valve. ده بيؤدي this causes بقى this murmuring sound. Then there is enlarged spleen. Of course, any inflammation in the body بتؤدي إلى enlargement of the spleen and anemia. The treatment, intensive course of penicillin. The penicillin is still active, and this streptococci in general didn't acquire resistance against penicillin. So you'll find always that penicillin is the drug or antibiotic of choice for treating streptococcal infections. This is for the treatment, but of course, prevention is more important. In patients with congenital or acquired vulvar diseases, they must take 600,000 units procaine penicillin injection 2 to 3 hours before any oral surgery. Example, dental extraction, tonsillectomy, أي operation بتتم surgical operation in the mouth. الشخص اللي هو is suffering from congenital or acquired vulvar disease مفروض dentist to ask the patient to know knowledge about the history of the patient. So if you know that he have anything in his heart valves, he must give him this treatment before doing the operation. to prevent the subacute bacterial endocarditis. في حاجة برضو I forgot to tell you about. Why do we call it subacute? To differentiate between it and any other bacterial endocarditis. Subacute means between acute and chronic. But here it gives us another meaning also, that this case occurred in an abnormal heart. If you call it bacterial endocarditis alone, it means that this is due to a primary infection to the heart. But subacute, usually it is due to being occurring to an abnormal heart valve. Okay? Prevention, we finished this. Go back to the second slide. Here, this is a picture showing the normal aortic valve, and here the aortic valve with bacterial endocarditis. Sometimes the patient with subacute bacterial endocarditis have certain deformity in his nails, like this picture. Okay? يبقى في تغيرات في شكل ايه الضوافر الايد زي ما الصورة هنا موضحة. The second example of Veridens group, Streptococcus mutans. Streptococcus mutans, it is also non-Lancefield, has no Lancefield group, and it is alpha hemolytic. This organism is responsible for dental caries or tooth decay, اللي هو تسوس الأسنان. It secretes an extracellular enzyme known as dextrane sucrase. The substrate for this enzyme is sucrose. It ferments sucrose, converting it to a large insoluble polymer known as glucane, اللي هو common name بتاعه المعروف اللي هو البلاك, and fructose. طبعا sucrose هيجي منين? From where will this sucrose be found in our mouth? It will be found as a remains of any sugary substance. We have eaten it and we didn't wash our tooth. This glucane helps the bacteria to adhere. واحنا جبنا سيرتها in the introduction. Ways of adherence كانت بإفراز this organism أو تكوين this glucane اللي هي sticky substance اللي بتبقى موجودة on the tooth, so helps this sticky substance to adhere the bacterium. Then the bacterium ferments the fructose, again forming acetic acid and lactate, and this in turn causes the decalcification, and the tooth enamel begins to lose its calcium and decay of the tooth, leading to this dental caries, as you see in the picture. اللون الأسود ده, the black color, is due to the decay of the tooth. A prevention, since this enzyme functions only on sucrose, so avoidance of candies or any sugary substances between meals is effective in reducing tooth decay. يعني ما ناكلش حاجات سكرية بين الوجبات وبعدين ما بنغسلش اسناننا, فده ممكن يؤدي إلى this tooth decay. It's advisable of course إن احنا نعمل tooth brushing, نغسل سناننا بالفرشة, tooth brushing at least twice daily. tooth brushing ممكن ما تقدرش تشيل قوي الفود remains stuck between the tooth, so we can also do flossing. Flossing is done, بتتعمل by a certain thread بنسميها floss thread. دي بتبقى rigid, it is rigid and flexible piece of plastic, so it can be easily passes between the tooth and removes any remains of food. So if this is done daily, it would be a good hygienic method for a good hygienic habit to do daily to clean the mouth. It reduces both tooth brushing and the flossing, removes the amount of the bacteria in the mouth and the plaque from being formed in your mouth. Number 3, Enterococcus faecalis, formerly known as I said, Streptococcus faecalis. It is group D. It is gamma or alpha hemolytic. It is considered one of the normal flora of the large intestine, which may cause subacute bacterial endocarditis. نفس الكلام, the same as we said بالنسبة للستريبتوكوكاس ساليفاريوس، بس هنا هيبقى الأورجانيزم موجود في الانتستين وممكن يوصل للبلاد برضو ويروح الهارت ويعمل subacute bacterial endocarditis. Due to its high resistance towards antibiotics هنلاقي إن الانتيروكوكاس فيكاليس باختلاف عن ال other streptococci acquired resistance against a group of antibiotics. So it causes problems in hospitals, causing nosocomial infections, second to Escherichia coli, which manifests itself as bacteremia. It may cause bacteremia in the hospitals. Patients staying in the hospital may suffer from bacteremia caused by this organism, urinary tract infection, or abdominal infection. In treatment, we have to choose a stronger antibiotic, example vancomycin or imipenem. Now we're going to start بقى نتكلم to speak about Streptococcus pyogenes, which is the major human pathogen. واللي هي المحاضرة كلها هتبقى بقيتها عن ال Streptococcus pyogenes. We call it group A, beta hemolytic streptococci, and بنديها الحروف دي اللي هي group A beta hemolytic streptococci. Group A beta hemolytic streptococci, which can be further differentiated into about 100 serogroups or even more. يعني ممكن نتيجة الميوتيشنز ممكن دلوقتي في أكتر يمكن من 200 serogroups of this organism. The serogroups دي are divided according to what? According to the M protein اللي هو موجود على cell surface. The M protein layer that covers the surface of Streptococci appears as a fringed border of fibrils. وهنشوف الصورة بتاعته كمان شوية. يعني عاملة زي الشراشيب. ال M protein دي عبارة عن protrusions كده طالعة من السيل وول زي الشراشيب حوالين الايه؟ السيل وول. This M protein and streptococcal capsule are the two key antiphagocytic structures. يبقى ال function of the M protein plus a streptococcal capsule. يبقى إذن طبعا streptococci also has a capsule. They are the two key antiphagocytic structures. يعني بيحموا البكتيريا from phagocytosis. So the body forms antibodies to the M protein. Antibodies to the M protein are opsonic and protect the patient from developing diseases by group A beta hemolytic streptococci strains. يبقى both are antiphagocytic and the body can form antibodies against the M protein. It's a protein substance فالجسم بيكون antibodies against it which can give protection to the patient from diseases caused by this group A beta hemolytic streptococci. But if we recognize here في عندنا كام M group؟ عندنا more than 100 serogroups. فلو ال body formed antibody against one serotype, of course it will not be immune against the other 99 serotypes. ولكن however برضو في نقطة مهمة, an important point that the streptococcal capsule, as we said, it is antiphagocytic, but it is not antigenic. بإذن the body will not form antibodies against the capsule. Why? If you can تفتكروا بقى memorize our first lecture اللي احنا قلنا فيها, because this capsule is not made of polysaccharide as the usual capsules, but is made of hydrated hyaluronic acid, which is indistinguishable from ground substance in the human joint. اللي هو ال connective tissue is made of the same substance, so the body will not differentiate between it and the hyaluronic acid in its connective tissue, وبالتالي it is not antigenic to our body. ودي كانت من الطرق, the ways we said that the bacteria hide itself from the immune system. Group A beta hemolytic streptococci can be differentiated from other species of streptococci by being sensitive to low concentration of bacitracin 0.02 microgram. يعني هنا لو حبيت أفرق بين this organism, this species اللي هو ال Streptococcus pyogenes from other species of streptococci, I can differentiate by its sensitivity to this bacitracin. Now we want to see بقى ال virulence of this strain. ليه هو highly virulent واعتبرناه major human pathogen وبيسبب مشاكل كتيرة قوي و many different diseases. First of all, we can see the exoenzymes and the exotoxins. Streptococcal exoenzymes and exotoxins. يبقى أول حاجة في الفيرولنس طبعا الكبسول والأمبروتين اللي هم ليهم antiphagocytic properties. نيجي بقى للإنزيمز. الهيمولايزنز we have two types of these hemolyzins and we give them اسمهم streptolysin O and streptolysin S. This O stands for what? Because it is oxygen labile وبنرمز لها ب SLO. It is oxygen labile, so it has its hemolytic effect only in anaerobic conditions. يعني لازم يبقاش فيه oxygen عشان تبقى active. This kind of streptolysin. This streptolysin O binds to cholesterol containing sites on the erythrocyte membrane. يبقى ده الميكانيزم of action of this enzyme إن هو binds with the cholesterol containing sites على erythrocytes على RBCs, so it causes destabilization of the membrane. نتيجة لكده بيحصل lysis as a result of the osmotic pressure. يبقى هو بيعمل destabilization. الممبرين بتاع RBCs أصبحت not stable. فأي تغير في osmotic pressure, any change in the osmotic pressure will cause the lysis, the complete lysis of the erythrocytes. وده اللي بيشرح ليه هي is beta hemolytic اللي هي بتعمل complete hemolysis لل RBCs. This streptolysin O may also, another mechanism of action, damage the cardiac cells. And it has also been shown to destroy, another thing, the polymorphs by causing their lysosomes to spill into the cytoplasm. أنا عارفين اللايسوزومز دول عبارة عن lytic enzymes موجودين في اللايسوسوم. فلما these lysosomes are spilled into the cytoplasm بيعملوا destruction للcytoplasm. فبيكسروا بالطريقة دي البوليمورفز. الستريبتولايزين O is antigenic. يعني معناها ايه antigenic؟ يعني الجسم هيتعرف عليها انها antigen ويبتدي يكون antibodies against the streptolysin O. These antibodies are called anti-streptolysin O. وبنكتب يعني الرمز بتاعهم is ASO. This anti-streptolysin O can be detected in the sera of patients suffering from streptococcal diseases, and we'll see that this will be a good tool for the diagnosis of streptococcal infections, some streptococcal infections. Streptolysin S. This S stands for being stable to oxygen. بعكس الstreptolysin O, they cause hemolysis in aerobic conditions. But this kind of enzyme is non-antigenic. يعني معناها the body can't form antibodies against this streptolysin. Number 2, streptococcal pyrogenic exotoxins. Previously known as erythrogenic toxin because they caused the disease scarlet fever, where scarlet fever causes red rashes on the skin. So it was first known as erythrogenic, معناها انها بتعمل erythema يعني redness of the skin. Or it was called scarlet fever toxin اللي هو مرض ايه؟ الحمى القرمزية. There are 4 such toxins أو exotoxins named A, B, C, and F. A and C are lysogenic toxins. Can you remember the meaning of lysogenic? يعني produced by a certain phage. Lysogenic toxins. Present طبعا الphage ده اللي هو bacteriophage present inside the chromosome of the bacteria. يبقى أول معلومة أول information نعرفها عن this toxin that A and C are lysogenic. And they are responsible for the scarlet fever and the toxic shock-like syndrome. طبعا these are 2 diseases we're going to deal with إن شاء الله. Streptococcus pyrogenic exotoxins are considered super antigens. Again, we are going Now بقى to explain what is the meaning of super antigens. Like mean before we took toxic shock syndrome toxin 1 في الستاف and Staphylococcus enterotoxin B اللي هما الاثنين كانوا proved to be also a super antigens. فاحنا دلوقتي عايزين نعرف بقى ما معنى super antigens. انا طلبت منكم طبعا to do a research on this word. الله اعلم انتوا دورتوا ولا لا، فهضطر بقى دلوقتي ايه طبعا اشرح لكم. What is super antigens? We're going to start first to explain how a normal antigen works in the body. We know that there is بقى a cell اللي اسمه الانتيجين presenting cell. فكركم كده بحاجات اخدتوها في الإيميونولوجي في الترم اللي فات from your immunology course. antigen presenting cell اللي هي السيل مثلا زي الماكروفاج اللي هي عملت فاجوسايتوزز للانتيجين او للاورجانيزم، وبعدين بتبتدي بعد ما بتعمل لايسيس للذس foreign substance جزء من الانتيجين is represented outside the cell، عشان كده سميناها antigen presenting cell. It is represented outside binding to the major histocompatibility complex class 2 اللي هي الريد كولر، ده الميجر histocompatibility class 2 وده الجرين كولر اللي هو الانتيجين. طب ده الكومبلكس ده المفروض يعمل ايه؟ يعمل اكتيفيشن للتي هيلبر سيلز. فالتي هيلبر سيلز اللي هي بتبقى specific للthis complex can come and bind to this complex ويحصل لها activation. Normally any antigen can activate or bind to a certain number of these T helper cells اللي هي ال T cell receptors. لازم يبقى specific so that it can bind to the complex. بنقول بقى إن السوبر أنتيجين بيعمل إيه؟ bypass the classical antigen processing procedure. ما بيعملش كده. It doesn't do this procedure. It bypass this classical بعتبر ان دي الكلاسيكال antigen processing procedure. لا، we call them they are polyclonal T cell activators. How come؟ بنقول ان هو binds بدل ما يحصل البايندينج بالطريقه دي it binds by another way زي ما احنا شايفين بقى في الجزء ده في الفيجر اللي على الشمال on the left. Here this is a super antigen. It binds from outside like this. فإت binds the major histocompatibility complex with any TCR, with any T cell receptors. It mustn't be specific. It can bind with any T cell receptor. If we say in the first case, the number of T cells activated may reach to 0.001% of the T cells only can be activated by a normal antigen. A super antigen can activate between from 5 to 40% of the T cell population of varying specificities. Okay? Of any specific. مش لازم يبقى specific. فبالتالي بيعمل activation لعدد كبير قوي من ال T cells. A large number of T cells are activated. So what? احنا عارفين بقى ان T cells لما يحصل لها activation تبتدي تعمل ايه؟ It leads to the release of cytokines, monokines, and many other mediators. فالamount of these mediators in the case of super antigens هتبقى حجمها الاماونت هيبقى قد ايه؟ هيبقى huge amount نتيجة ان عمل activation لنمبر a big number of these T cells. This will result in excessive and disordered inflammatory response with systemic toxicity including peripheral vascular collapse. Peripheral vascular collapse يعني معناها ايه؟ Means a severe drop in blood pressure and shock. And that's why we call these toxins a pyrogenic. And if you remember from our first lecture, when we were comparing between the endotoxins and the exotoxins, we said that the exotoxins sometimes are pyrogenic. فده اللي بيشرح الموضوع ازاي الجرام بوزيتيف exotoxins can be pyrogenic because they can act as a super antigen. اوكي؟ اتمنى ان انتوا تكونوا فهمتوا يعني ايه super antigen. طبعا ال peripheral vascular collapse بتؤدي الى ايه؟ إلى severe drop in blood pressure that, as I said, and shock. The same الناتج بتاعها the result will be as as the endotoxin shock اللي هو produced by the gram negative bacteria. ننقل بقى نشوف other exoenzymes. We have Streptodurnase. We will find that these enzymes help also in the spreading, invasiveness of the bacteria. As we said, this group of bacteria has a strong ability of being invasive. So we have Streptodurnase. This is an enzyme that lyses the DNA, so we call it DNase. It believed to degrade the DNA that is released into boils, resulting in the liquefaction of thick exudates of pus and necrotic tissues, so promotes what? Bacterial invasiveness. NADase, the same, goes with an enzyme which can cause lysis to the nicotinamide adenine dinucleotide, causing also hydrolysis of the NAD. Streptokinase. Streptokinase is similar to the staphylokinase اللي احنا قلنا it is a fibrinolytic enzyme. So it cleaves a plasminogen, turning plasminogen to plasmine. Then the plasmine has a fibrolytic action which تعمل ايه بقى؟ تدوب blood clots. بتدوب dissolves fibrin. So it is fibrolytic. This enzyme has a very important therapeutic use. تستعمل في العلاج، في علاج ايه؟ الجلطات، لانها بتدوب الجلطات. So this streptokinase has a very good therapeutic use to get rid of blood clots. Hyaluronidase, and we spoke about it before, اللي هي spreading factor اللي هي برضو بتكسر الهيالورونيك acid, causes lysis للhyaluronic acid الموجود في connective tissue فكان helps spreading the organism in the tissues. Complement 5A peptidase, it protects the organism by the degrading complement 5A. Immunoglobulin A's, طبعا the word A's, this suffix means to destroy or to cause lysis. فimmunoglobulin A's, it splits secretory immunoglobulin A. So protect the organism from the anti-adherence properties of this secretory immunoglobulin A. It can get rid of this immunoglobulin E by destructing them, so they can help their adherence. Here this picture shows the structure of the Streptococcus pyogenes. This is the cell membrane. These اللي هم البروتروجنز دي هم البيلاي اللي هي الام بروتين تايب. This is the M protein اللي زي ما قلت عامله زي الشراشيب على السيرفس، طالعه على السيرفس of the organism. بعد كده بتيجي البيبتيدوجلايكان cell wall which contain the C carbohydrate antigen اللي accordingly we divided the Streptococcus pyogenes into the the Streptococci in general into the different lens-filled groups, and here of course Streptococcus pyogenes will be group A. Finally the capsule اللي هو made of hyaluronic acid. طبعا this organism has the ability to produce extracellular substances including streptolysins, NAdase, hyaluronidase, streptokinase, streptodurnase, and the pyrogenic exotoxin اللي هو ايه؟ اللي هو السوبر انتيجين اللي كنا بنشرحه من شويه. Okay? Next, infection caused by group A beta hemolytic streptococci. Now we want to know about the infections caused by this organism. Number one, streptococcal pharyngitis. The أكتر, the most common kind of infection which can be simple or can be self-limiting اللي هي streptococcal pharyngitis. The common name بتاعها اسمه ايه؟ The common name is strep throat. The mode of infection by droplet infections or by the patient's own organism. As we said, it can be living as a normal inhabitant في النازopharynx, so it can be a normal flora. which is carried in the oropharynx. الباثوجينيسيس ده ممكن يبقى ملخص لكل الكلام اللي احنا قلناه. الباثوجينيسيس Streptococci adhere, so it has the ability to adhere to the oral mucosa via the lipoteichoic acid and the fibronectin binding proteins. They escape phagocytosis due to the M protein and the capsule. The same يعني كل الكلام ده احنا قلناه قبل كده. It elicits localized inflammation due to the polymorphs mediated damage, as we said برضو في الانترودكشن بتاعت الستريبتوكوكاي, of the infected mucosa, and also due to activities of the streptolysin اللي هو الهيمولايزين and various extracellular streptococcal enzymes. الكلينيكال symptoms بيبقى فيه sore throat, of course, fever, nausea, malaise يعني تعب, and abdominal pain may also be present. طبعا أهم حاجة أهم feature of this symptoms of streptococcal strep throat is the throat. The throat and the soft palate are edematous, بيحصل لهم swelling and inflamed with purulent exudates. زي ما انتم شايفين هنا منظر الثروت from the inside بيبقى كله مليان باللون الأبيض اللي هو عبارة عن pus اللي هي purulent exudates. ودي very characteristic للinfection of the strep throat اللي هو الوايت color اللي بيبقى موجود في الثروت. Also the cervical lymph nodes may be enlarged اللي احنا بنسميها cervical lymphadenopathy. Infection is usually self-limited. It may take 5 days ويحصل recovery alone. ولكن ممكن يحصل complications. لو الاميون سيستم مش قوية ممكن يحصل complications أو ما حصلش treatment صح ممكن يحصل complications. الأورجانيزم زي ما قلنا it has a great ability for being spread, فيحصل invasiveness لكل الاريا حوالين الثروت, فممكن يروح للإيرز ويعمل otitis media. Rarely it may goes to the brain أو cerebrospinal fluid causing meningitis, and it sometimes causes also pneumonia as a secondary infection with other viral respiratory diseases as a secondary infection. The same we said الكلام ده قلناه برضو فين مع Staphylococcus aureus. Skin infections. Skin infections we have أول واحد الإبتايجو, ودي برضو we said it in the staff, it is like Staphylococci, symptoms like Staphylococci. It is an inflammatory process like those seen in the pharyngitis, but الانفولفمنت هنا بيبقى أكتر للإكسترا enzymes اللي هما Streptodurnase, NAdase and hyaluronidase play a greater role. يعني مين هنا اللي مش هيبقى ليها الرول؟ الستريبتولايزين. يبقى الستريبتولايزين ملوش رول in the skin infection. السيمتومز طبعا this impetigo we can also call it pyoderma, واحنا قلنا اسمها بالعربي الحصف. السيمتومز افكركم بيها, I can memorize you with the symptoms اللي هي بتبقى عبارة عن thin walled vesicles بيحصل لها burst بتفرقع and then it forms a crust over يعني بتعمل قشرة, وبتبقى موجودة around the nose and around the face, in the face, around the nose and mouth. يبقى دي أول skin infection. تاني skin infection erysipelas. Erysipelas in Arabic we call it بالعربي الحمرة. This infection mainly is in the soft tissues and the lymphatics, which is usually seen in the face and the lower extremities. وهنا باين في الصور إنها موجودة on the face and on the leg. Occurs often in young children and elderly. طبعا الناس اللي هم with weak immunity بيبقوا liable إن يجيلهم this erysipelas. بيحصل إمتى؟ when organisms are introduced into the skin through wound, fissure or abrasion. يبقى بتختلف عن الستاف. لما كنا بنتكلم في الستافيلوكوكال skin infections كنا بنقول إن الأورجانيزم can enter through a hair follicle ويبقى السكين intact ما فيهوش أي normal ما فيهوش أي إصابة. لكن here the organism to be introduced to the skin it needs a wound or a fissure يعني شق في الجلد or abrasion يعني مجلوط، يبقى في الجلد مجلوط فيحصل ان الاورجانيزم can enter. الاورجانيزم multiplies within the soft tissues and the lymphatics. السيمتومز طبعا السيمتومز it's skin infection but بتبتدي الاول بفيفر وشيلز وفاتيج وهيديك وممكن برضو vomiting within 48 hours قبل ما يظهر الايه الراش بتاع الانفكشن. بعد كده then the erythematous skin lesions begin to appear. نشوف السيمتومز بتاعتها هنلاقيها painful hot وبيحصل فيها swelling ولونها ريد، فدي كلها حاجات تشبه للبيرن. لما الجسم السكين يحصل له بيرن بهوت اوبجكت دي بتبقى هي نفس السيمتومز، ان يبقى فيه ريدنس، بيبقى فيه painful، طبعا اي حرق بيبقى فيه الم، بيبقى سخن، مكان الحرق بيبقى هوت، وبيبقى بيحصل فيه swelling وسكالر از ريد. بس الفرق بقى بينه وبين البيرن العادي ان بيحصل rapidly this lesion بيحصل لها rapidly spreading، يعني it increase in size. أي burn طبعا بيفضل ثابت حجمه، بيفضل stable in size، لكن هنا بيحصل increase in the size by rapid spreading of the inflamed area of the swelling. وحاجة برضو تانية characteristic تفرق بينه وبين البيرن إن بيبقى فيه حوالين الليجن dark bright red margin، وده يمكن باين أكتر في الصورة دي. In this picture you can see here the red lesion and it is surrounded by a bit darker red in color. So this بيدي الكاركتر بتاع this kind of infection. This kind of infection was known in the past as Saint Anthony's fire. So even if you look يعني لو انت بصيت على النت ودورت على كلمة Saint Anthony's fire هتلاقي كلمة erysipelas هتطلع لك، يبقى دي مرادف لنفس المرض. Saint Anthony's fire جت الكلمة this name came from what يعني للعلم بالشيء it as prayers were offered for its victims. يعني كانت الناس بتدعي they are praying for the victims of erysipelas to get cured in a chapel يعني small church في كنيسة صغيرة. كانت اسم الكنيسة دي سانت أنتوني. الحكاية دي كانت موجودة فين؟ in the United Kingdom في إنجلترا. كان في chapel يعني كنيسة صغيرة اسمها سانت أنتوني. البيبل كانوا بيروحوا to pray for the victims of erysipelas in this chapel. من هنا جت التسمية سانت أنتوني's fire. أنا بحب أذكرها عشان تفكرنا بالsymptoms. It memorize us with the symptoms of the disease that it is like a fire أو like a burn. وللعلم بالشيء مين هو سانت أنتوني ده؟ This is a priest an Egyptian priest. يعني الاسم الشابل ده على اسم واحد Egyptian وكان موجود زمان عايش في is living in our western desert. وتسمى this chapel after his name اللي هو بالعربي اسمه أنطونيوس. Okay. The danger of erysipelas is not due to the localized inflammation. ولكن the danger lies in the life-threatening sepsis اللي هو كcomplication لthis kind of skin infection إن يحصل sepsis and or pneumonia may develop after erysipelas. وفي another point is important that a patient who gets erysipelas can recur يعني erysipelas ممكن يرجع تاني يحصل recurrency للerysipelas in 18 to 30% of cases even after treatment. يعني الشخص اللي بيجيله erysipelas his body doesn't acquire immunity against it, so he can get erysipelas more than once in his life. From 18 to 30% of the cases can يحصل reoccurrence. Necrotizing fasciitis. Necrotizing fasciitis in the 1990s. الجرايد في أمريكا العناوين الجرايد the USA newspaper headline said طلع منشورات في الجرايد إن في patients leg dissolved by flesh-eating bacteria. يعني الناس اعتقدت إن there is a new bacteria At this time of the years 1990s, it was the beginning of the AIDS. والAIDS of course أثر في الاميونيتي of the people. فده أدى إلى الضعف في الاميونيتي، فظهرت بقى flesh eating bacteria they called it at that time, and the public was fascinated and horrified from this disease, and they consider it a new disease arising. فالناس اترعبت من هذا المرض اللي هو بيعمل ايه؟ بياكل اللحم بتاع الايه؟ الانسان. يبقى bacteria that eats the flesh of our body. However, this necrotizing fasciitis is not a new disease. It was no long ago, and it was referred as، كان لها تسمية أخرى، يعني زمان كانوا بيسموها hemolytic Streptococcus gangrene. يبقى it was known from long ago as hemolytic Streptococcus gangrene, 1920. It is known from the 1920 of a disease called hemolytic Streptococcus gangrene. بس قلت إيه سبب إنه رجع تاني أو ظهر تاني من جديد؟ نتيجة الإميون سيستم الضعيفة. It begins 1 to 4 days after an initial trauma. يبقى برضو هنا there must be a trauma to introduce the organism to our body, زي in the case of erysipelas, like in the case of erysipelas. And as I said, it is usually in individuals with compromised immune function. ما بتحصلش لأي شخص بالمناعة الطبيعية، لا it must have a very weak immune system. Swelling begins with heat, erythema, and tenderness. يعني it begins like the erysipelas. برضو بيبقى في heat in on the body، يعني في المكان اللي هيحصل فيه الانفكشن لو كان the leg زي in the pictures here. And erythema, redness, and tenderness. The lesion progress in an alarming speed، بسرعة شديدة جدا، very quickly. بيحصل change في الcolor اللي احنا قلنا عليه red color ده will change from the red to the purple then to the blue. As we can see here in the picture, we have the red and we have the blue color on the skin. After 7 days the skin separate. اللي بيحصل ايه؟ ان السكين نفسه is removed. Okay, separate to reveal, to show that the underlying tissue is necrotic. فهيبان ان في بقى الجزء ده بيبقى black in color. يمكن الصورة دي مش very severe، هوريكم صورة بعد كده هنلاقي ان الفلاش تحول لونه change the color to black، اللي هو بيبقى حصل فيه necrosis. The wound is anesthetic at the end. when بيحصل necrosis of course there will be no sensation of pain at the beginning. It is very painful at the beginning. طبعا الأول بيبقى فيه وجع جامد، ولكن في الستيج at the late stage the sensation will be lost. نتيجة إيه؟ because the nerves passing through the superficial fascia are destroyed. Of course the word fascia means not the هنا this picture tells us what is the fascia. Here is the skin, the super يعني الطبقة العلوية خالص هي السكين. بعد كده then there is the fat and then the fascia and the muscular tissues. The muscles and the fascia are شوية beneath the skin. وهنا بيقولك changing the skin color represents spread that is not visible on the surface. وفجأة suddenly the skin is بيحصل له shreds، يعني بيقع وبيبين بقى necrosis underneath the skin. Usually bacteremia may develop to half of the patients. The next picture we can see another necrotizing fasciitis. وبرضه هنا بتورينا بقى necrosis final form of this necrotizing fasciitis. Now we were going to shift to the toxigenic disease. يعني disease not due to the enzymes but due to the toxins. Exotoxins اللي هو mainly اللي احنا قلنا عليه ايه super antigen اللي هو Pyrogenic exotoxins. The disease involved is scarlet fever اللي هو الحمى القرمزية. Scarlet means red اللي هو لون القرمزي. So طبعا هيبقى فيه rash جامدة, a strong rash, red rash on the patients as symptoms of this disease. This disease is caused by lysogenic group A beta hemolytic streptococcal strains producing the Streptococcus Pyrogenic Exotoxins اللي هو formerly known as the Erythrogenic toxin. It is an acute infection of childhood, although rare before 6 months of age due to maternal immunity. So it is mainly a childhood infection. The mode of infection by nasal and throat secretions. نشوف الsymptoms. The symptoms include fever, pharyngitis, يعني it begins as if it is a strep throat عادي. بعد كده يبتدي يظهر الراش. الراش بقى distinct erythema احمرار with punctate red spots. يبقى الراش هنا هيبقى punctate منقط. Starts first on the face ودي حاجة characteristic the way the rash starts on the body. It starts first on the face except around the mouth. And this case we call it circumoral pallor. Circum جاي من circular لأن الحتة اللي هي بتبقى white in color بتبقى circular around the mouth و oral around the mouth. Pallor جاي من إن هو it is pale in color because it is white in color. So this circumoral pallor, which is very specific specific signs of this disease. Then it extends to the chest, trunk, and then the extremities. The patient's tongue كمان is very characteristic. It is coated with large papillae, and so they call it strawberry tongue. It looks like a strawberry زي شكل الفراولة زي قشرة الفراولة بتبقى فيها اللي هي البابيلي large papillae نتوءات طالعة كده عاملة زي الايه الستروبري. The rash fades within 2 to 5 days. بعد 2 to 5 days يبتدي الراش يخف يبتدي لونه يحصل له fading in the color ويبتدي يحصل desquamation and it starts to يحصل لها desquamation occur. The scales which comes out from the skin are not infectious. يبقى الانفكشن بتيجي بس من ايه؟ من الدروبلت infection. لغاية كده we didn't see the effect of the toxic shock, the super antigenicity. The super antigenicity can occur بقى امتى تبان في severe cases. يبقى scarlet fever can be mild, but it may be life-threatening with signs of systemic toxicity and shock. بقى الكلمتين دول signs of systemic toxicity and shock اللي هي describes the symptoms due to the super antigenicity of the toxin. And here of course we can see the rash مالي الجسم. The trunk and the chest is full of the rash. The red punctate منقطة نقط حمراء. With this picture shows the circumoral pallor around the mouth and the nose, white pale in color, and the rest of the face is red in color. Immunity. An attack of scarlet fever may give lifelong immunity against this erythrogenic toxin. يعني معناها the body produces specific antitoxins against this toxin. فالشخص اللي suffer from scarlet fever once doesn't suffer again from scarlet fever. بس ده مش معناه ان هو اصبح immune to all streptococcal infections, of course, but the person is still liable for subsequent attacks of other streptococcal infections. انها not due to the toxin. يبقى هو اصبح عنده immunity against the toxin only, not against the streptococci in general. Here this is another picture, shows the strawberry tongue اللي هي كلها papillated with the red color عاملة زي شكل شوية الايه looks a bit like the strawberry, so they call it, it's a very characteristic strawberry tongue. And برضو هنا it's clear the circumoral pallor. The second toxigenic disease, toxic shock, and we call it like because it is like the toxic shock syndrome produced by Staph aureus. So they call it toxic shock-like syndrome. Its Arabic translation is a bit difficult. اسمها متلازمة الصدمة السامة. متهيألي الكلمة دي أنا ما سمعتهاش قبل كده. So كفاية إن احنا نعرف toxic shock-like syndrome. It caused mostly by the serotypes that produce برضو Streptococcus Pyrogenic Exotoxin A. يعني برضو it's a super antigen. الفيتيلتي ريت ممكن توصل ل 30% due to the hypotension and the multi-organ failure. وزي ما قلنا it is similar to that toxic shock syndrome caused by Staph aureus. C, we're speaking about the last toxigenic disease اللي هي puerperal sepsis. بالعربي حمى النفاس. The modern aseptic techniques and the antibiotics have eliminated much of this type of infection. ما بقاش منتشر this type of infection نتيجة الhygienic methods اللي بتتم في during labor and the use of antibiotics. This kind of infection is minimized to a great extent. It is due to the infection of uterus during puerperium or after abortion بعد الإجهاض through contaminated hands and instruments causing septicemia. وفي برضو مهم يعني to notice that this puerperal sepsis مش بس caused by Streptococcus pyogenes, it also can be caused with conjunction with other gram-negative bacteroids. Laboratory diagnosis of group A beta hemolytic streptococcal infections. Diagnosis is based largely on clinical grounds. يعني على السيمتومز زي ما شفنا السيمتومز can be very clear. ممكن مجرد بالسيمتومز بالclinical examination we can know the disease. But of course we need many times to do the laboratory diagnosis. First, the materials from the lesion can be gram stained. Pus and biopsy materials and blood samples should be cultured, of course, on blood agar زي ما اتفقنا. We need enriched media to grow this organism. ELISA or agglutination technology can provide a quick and cheap way of diagnosis, allowing treatment to be started immediately. وهنا immediate treatment is very important, especially in children. عشان هنشوف دلوقتي إن في complications of the streptococcal infections can be very serious. عشان كده لازم إن احنا نعالج. We have to treat any streptococcal infection from the beginning, especially in children. But for adults, it is even more advised to wait. يعني مش أي حد يجيله شكة في زوره يروح جري ياخد antibiotics. You mustn't hurry up to take antibiotics if you have any pharyngitis. You have to stay for several days to allow your natural immune system to work. وهنلاحظ إن الشخص اللي بياخد antibiotics على طول كده very quickly he gets recurrence كتير قوي. تلاقي كل شوية يجيله pharyngitis. It is advisable for adults, not for children. This is very important. For adults to wait a bit for your immune system to work, so you have natural immunity. If the results are uncertain, serum should be tested for anti-streptolizin O. اللي احنا قلنا اللي هو antibodies against streptolizin O, or antibodies against these different enzymes اللي هي DNAs, NADAs, and the hyaluronidases. But this anti-streptolizin O titer is not helpful in skin infections. لأن we said كمان before احنا قلنا الكلام ده إن في skin infections الانفولفمنت بيبقى أكتر لthese enzymes مش الانتي-streptolizin O. ففي skin infections ما ندورش أبدا على الانتي-streptolizin. التريتمنت. As I said, البنسلين is still active وهو ال drug of choice for Streptococcal pyogenes. For oral penicillin V or intramuscular injection of penicillin G, benzathine is highly effective if group A beta hemolytic streptococci is confirmed. When you are sure that you have this organism, penicillin is the drug of choice. طبعا في people are allergic to penicillin, فلازم نشوف لهم حاجة substitute حاجة مختلفة أو different يعني than the penicillin, so we can give them cephalosporins or erythromycin. In case لو كان عندي very dangerous situation and I want to give the drug quickly, I can use empiric therapy. I'm not sure that I have group A beta hemolytic streptococci, so I need an empiric treatment, so I can give a combination. In this case, can I make a combination? For instance, كexample ampicillin with gentamicin, with clindamycin or metronidazole. In addition to the previous systemic antibiotics, the following measures must be applied in certain cases اللي اتكلمنا عنهم. زي impetigo, this skin infection احنا قلنا topical mupirocin is very effective. Erysipelas, in this case we need to لو حصلت دي في ال lower extremities في الليمس، المفروض الشخص doesn't move his legs، فالمفروض يعمل embolization and elevation of the infected area with application of moist heat. في other opinions إنهم بدل moist heat can use كمادات ساقعة cold نسميها إيه wait a minute بقى عشان إيه pause. We can use cold compresses اللي هي كمادات ساقعة. ففي ناس في دكاترة يقولوا كده وفي يقولوا application of moist heat. Necrotizing Fasciitis and Toxic Shock-like syndrome، هنا the infected area must be surgically explored عشان ننظف المنطقة. We have to clean the infection, okay? And immediate treatment with, of course, antibiotics. Now we're going to begin بقى. A very important part of our lecture is the secondary immune-mediated diseases due to group A Streptococci. ساعات بيختصروا ال GABHS دي اللي هي group A beta hemolytic streptococci and they call it على طول ايه group A Streptococci. فممكن تقابلوا برضو اللي هي الاختصار بتاع ال Streptococcus Pyrogenitis written as such. So we can call it immune-mediated or we can call it late non-suppurative complications of group A beta hemolytic streptococci. We have two diseases under this complications. Number one, acute rheumatic fever. We'd like to know the epidemiology of this acute rheumatic fever. Worldwide, عالميا, rheumatic heart disease is the most common cause of cardiovascular death in children and young adults, with about 30 million children suffering from the disease, especially in developing countries. وهنلاقي ان في البلاد اللي هي developed countries بيعانوا اكتر الchildren برضو من امراض في القلب، بس is not due to this organism او مش acute rheumatic fever. في حاجه اسمها كawasaki disease لو حبيتوا تدوروا عليها. كawasaki disease is برضو ايه heart disease، ده منتشر قوي is widespread in Japan mainly. بدأ in Japan وموجود برضو بكمية كبيرة in the United States اسمه Kawasaki disease. But for developing countries, rheumatic fever is the number one cause of cardiovascular death in children and young adults. اشمعنى في developing countries as access to health service is limited and due to the overcrowdedness and the poor conditions of living. This gives a great risk to acquire this kind of infection. Acute rheumatic fever occurs as a complication of Streptococcal Pharyngitis or Scarlet fever. يبقى بتيجي بعد pharyngitis و Scarlet fever. Doesn't come after skin infections of Streptococci. It occurs in about 3% if the patient is untreated, especially the children, as I said, or the young adults. It occurs in 3% of the untreated patients who have never previously suffered from acute rheumatic fever. But it occurs, النسبة هتعلى قوي, the percentage increases to 40 to 50% to those who have suffered before from acute rheumatic fever. يعني من هنا نفهم إن اللي بيجيله acute rheumatic fever يحصل فيها recurrency عالي from 40 to 50% إن هو he can have another attack of rheumatic fever. طب why only 3% are caused by rheumatic fever? We will understand this now. Acute rheumatic fever typically begins 1 to 3 weeks after an attack of pharyngitis. Caused by إيه بقى? Caused by rheumatogenic group A beta hemolytic strain. What does it mean, rheumatogenic group A beta hemolytic strain? when we were speaking about the Streptococcus pyogenes at the beginning في الأول خالص قلنا قسمناها we divided it to several serotypes وصلوا ل 100 or even بعض التكست books say 200 serotypes. Only 10 of these serotypes اللي هي بتعتمد على الام بروتين only 10 strains from the 100M serotypes are rheumatogenic. يعني مش كل أي Streptococcus we encounter will be rheumatogenic. Only 10 out of 100 أو 10 out of 200 serotypes are rheumatogenic. But still we don't understand what do you mean by rheumatogenic. We'll understand it here in the pathogenesis. When we speak about the pathogenesis, why this occurs, this acute rheumatic fever. We know acute rheumatic fever is believed to result from antigenic similarity. Can call it mimicry. يعني في تشابه بين حاجتين. إيه هما الحاجتين دول؟ Two things have the same antigenicity. When patients are infected with the rheumatogenic streptococci, يبقى في حاجة اسمها antigenic similarity. يعني two antigens are similar when we are infected with rheumatogenic streptococci. The antibody made against the M protein of these rheumatogenic streptococci cross-reacts with the human cardiac tissue. مش بس the human cardiac tissue، يبقى إذا معناه إن في similarity in the antigen of the M protein of these rheumatogenic strains with the human cardiac tissue. And not only the human cardiac tissue, also there is similarity between this M protein with the serous and synovial membrane of joints. وده will lead to what? Causing the cardiac damage and arthritis. And this will cause the cardiac damage we're going to speak about and the arthritis اللي هو الالتهاب في المفاصل. يبقى إذا إيه اللي بيحصل؟ إن الانتيبوديز produced against the M protein will attack also the cardiac tissue and the serous and synovial membranes of the joints, causing their inflammation and destruction. Even this is the first cause of this acute rheumatic fever. If we encounter a serotype M protein having the same antigen similarity of our heart muscles, our heart tissues, and our joints, this will give rise to rheumatic fever. But this is the first point. دي أول نقطة. تاني حاجة, there is some evidence that the M protein اللي هو rheumatogenic ده اللي بنتكلم عليه ده of rheumatogenic streptococci strain acts as a super antigen. ففي بعض evidence in this M protein of the rheumatogenic strains have super antigenicity, so causing an exaggeration at the antibody response. The third point for the cause of rheumatic fever is other investigators have proposed a door of the streptolysin O toxicity in the generation of carditis. And we said this point in our introduction. في بداية السترeptococci احنا قلنا السترeptolysin O لما اتكلمنا عنه at the beginning of our lecture we said it has certain cardiac damaging effect. So these 3 points are the pathogenesis of acute rheumatic fever. الكلينيكال symptoms عايزين نشوف بقى symptoms هتظهر على المريض. ايه الكلينيكال symptoms which will appear on the patient. بنقسمهم, we divide them to 2 kinds of symptoms, major symptoms and minor symptoms. المajor symptoms include fever. طبعا it has to have fever, احنا بنسميها rheumatic fever, so it has fever. Carditis يعني معناها inflammation أو infection of the heart. But usually still valves are the most اللي هو valves of the heart are the most affected أو the most dangerous to be affected, especially كمان mitral valve. So carditis, and this of course carditis sometimes a person doesn't feel anything, but sometimes it is accompanied by weakness, shortness of breath, and chest pain. Then there is migratory polyarthritis. Migratory polyarthritis. this causing painful joints, especially big joints, especially المفاصل الكبيرة اللي في الجسم زي الني الركبة، الأنكل بتاع الرجل، الالبوز الكوع، والريست اللي هو بتاع الإيد. moving from joint to joint، عشان كده سميناه ايه؟ migratory، بيتنقل. It moves from place to place. Yeah, that's just to say the person begins to suffer pain in his left knee, for instance, then it goes to the right knee, then it goes to the ankle, and so on. So doesn't stay in one place. It is migratory. It is moving from one place to another. This polyarthritis occurs in 50% of the cases. يبقى معناها ان مش كل شخص بيجيله الروماتيك فيفر بيبقى عنده both carditis and polyarthritis. ممكن يبقى عنده one of them، ممكن يبقى عنده both of them، ممكن يبقى عنده carditis بس، ممكن يبقى عنده polyarthritis بس. Okay? These are the major symptoms. What about the minor symptoms? المinor symptoms عندنا 3 minor symptoms. Number 1 Sydenham's chorea. word chorea معنى كلمة chorea it means to dance. So ايه اللي بيحصل to the patient؟ انه بيحصل له jerky uncontrollable body movements. بنلاقي ان البيشنت يبتدي يعمل حركات لا إرادية involuntary strange movements. He moves his hands مرة واحدة كده تلاقيه بيحرك ايده. His head moves his head or his legs. So he moves jerky uncontrollable body movements. Number 2 subcutaneous nodules. These are small painless يعني ما فيهاش ألم painless bumps حاجات كده مكلكعة صغيرة تظهر under the skin. It appears under the skin often over bony areas. ودي indicates severe cases. يعني this doesn't always occur. minor symptoms doesn't always occur. دي occurs بس في severe cases اللي هي subcutaneous nodules. وهنشوف we'll see pictures for all these things. subcutaneous nodules. Erythema Marginatum, it's a characteristic rash. برضو بيحصل in 10% of cases only. It is red, irregular rash consisting of pink rings with clear center. يعني هنشوفها في الصورة we'll see it in the picture إن هي بتبقى عاملة زي as if you are drawing with a red pencil circles, irregular circles on the skin. So in the middle of the skin doesn't have the ring, the red color. And here this picture shows the valves اللي هي بيحصل فيها الانفلاميشن. Acute rheumatic fever has a marked tendency to be reactivated as I said before. لحوالي 40% it can 40% كان يحصل recurrency by recurrent infection. لو حصل infection again with Streptococcal Pharyngitis البرسن ممكن تاني يجيله rheumatic fever. Recovery from it occurs without residual damage to the joints. يعني if الشخص جاله rheumatic fever وحصل involvement of the joints بيحصل complete recovery after each subsequent attack. But there is permanent damage to the heart. الهارت بقى ما بيحصلش recovery ودي المشكلة. And this is the problem of the seriousness of the illness which increases with each subsequent attack and may lead to congestive heart failure if طبعا untreated. Here is Erythema Marginatum. As you see, irregular circles as if you are drawing red irregular circles on the skin. هنا باينة and here it is obvious. Okay, this is Erythema Marginatum. Subcutaneous nodules برضو هنا it's باينة على فوق bones of the vertebra. There is the small painless nodules appearing on the back of this person. And here is rheumatic arthritis. Here this is a diagram showing a joint and the effect of rheumatic fever on the joint. This is the normal form, and here there is infection, inflammation, thickening in the synovial fluid, as you see here. This is the synovial fluid, and this is the I can't read the synovial membrane. This is the synovial membrane. So بيحصل هنا ايه enlargement و inflammation جامدة in strong inflammation in the synovial membrane. And this is the shape of a hand suffering from arthritis. And as we see in this picture, this girl, she is begging for help. She is saying, penicillin prophylaxis, please. And as you see, she's suffering from migratory polyarthritis, from one elbow to one knee, and then to the next knee, and then to the other elbow. And she is suffering from Pancarditis. The word Pancarditis means the inflammation of the entire heart, including pericarditis, which is the inflammation of the sac around the heart, الغشاء اللي محيط القلب, and myocarditis, اللي هي muscles of the heart involvement, and endocarditis, as we said before, it is the lining of the heart, and the most important is the valves of the heart. And in case of rheumatic fever, the mitral valve, as I said, is the one mostly involved, which is the left, this is the valve connecting between the left auricle to the left ventricle. The diagnosis. Number one, elevation of erythrocyte sedimentation rate. This test يعني بتبين إن في inflammation in the body. It is not highly specific. It's not specific to rheumatic fever, but لما بيحصل elevation for erythrocyte sedimentation rate means that there is inflammation in the body. Electrocardiogram برضو gives a picture about the heart. Estimation of anti-streptolizin, this is highly specific. A high serum titer that persists for a long period indicates rheumatic fever. So usually they do the test, stay for some time, يستنى شوية, and repeat again the test. لو حصل elevation of the anti-streptolizin O titer, this indicates it's a case. A normal titer from 0 to 125 unit, a high titer from 160 to 290 unit. But these numbers are not يعني very accurate. يعني ممكن from one place to another place, region in the world, we can بيبقى في deviation في التايتر النورمال والهاي تايتر. اوكي؟ يعني ممكن ده يختلف من بلد لبلد. Finally, the treatment of acute rheumatic fever. Prolonged bed rest is no longer recommended unless it is necessary to control congestive heart failure. يعني في الحالات very severe cases بس الشخص لازم to stay in bed. بس لو هو حالته بسيطة, he can move around, can do his يعني يعيش حياته عادي without staying in bed. Salicylates, and but of course taking the treatment with it. Salicylates and corticosteroids are of equal benefit in the reduction of acute symptoms. عشان طبعا دي anti-inflammatory agents. Salicylates or corticosteroids. Penicillin, it doesn't alter the course of acute rheumatic fever, but it is usually administered once the diagnosis is definite of group A beta hemolytic streptococci. عشان طبعا البنسلين will kill the organism اللي هو the cause of the rheumatic fever, but it will not treat the symptoms of rheumatic fever. Sometimes in severe cases surgical operations is needed. يحتاج الشخص إنه يعمل عملية to change خالص the mitral valve لو حصل فيها damaging خالص. ففي بعض الأحيان بنحتاج لسيرجيكال تدخل جراحي يعني to change the mitral valve or with balloon catheter to expand the narrowed mitral valve. يبقى لازم في بعض الأحيان نحتاج لإيه عملية جراحية للعلاج. Chemo Prophylaxis, which is very important. It is of utmost importance to protect patients from reinfection. And this is achieved by penicillin G benzathine as a monthly injection. للناس بقى اللي مش غاويين الانجكشن ممكن ياخد oral penicillin V twice daily. And this chemo prophylaxis is usually continued into the 3rd decade of life until the patient, the child أو young adult reaches to his 30s للثلاثينات من عمره. Or for the rest of life. طبعا who decides this؟ الفيزيشن هو اللي decide بقى استمرار أخدان this penicillin. Sometimes طبعا another way of chemoprophylaxis إن هو بيتعمل الأنتي ستريبتولايزين O estimation periodically. Once the ASO increases, the person takes the antibiotic. If it is low, he can stop the antibiotic. The second kind of complication is acute glomerulonephritis. Acute glomerulonephritis is a rare disease, يعني قليل الحدوث. It occurs 21 days following streptococcal skin infections. يبقى ده mainly بيبقى بعد أكتر after skin infection. Sometimes after 10 days following streptococcal pharyngitis. بس mainly is دايما نحط في دماغنا إن هو after skin infections. It is caused برضو by بنسميهم Necrotizing strain. برضو في الام protein serotypes بيقولوا there about 7 of them are nephrogenic and can cause glomerulonephritis if we encounter this type of serotype. The pathogenesis of acute glomerulonephritis is primarily an immune complex disease. افتكروا بقى الحصص بتاعت الimmunology بتاعت your course of immunology. Of course you have dealt with the immune complex disease. What happens in this immune complex disease؟ بيحصل soluble complexes of the antibody and the streptococcal antigens. بيحصل a complex between the antibodies produced by the body against the streptococcal antigens. Okay, they combine together forming a soluble substance or a soluble complex. This soluble complex move in the blood and goes and deposits. يبقى تحول بقى من soluble to insoluble. هيحصل له deposition. Where? In the renal basement membrane. In the kidneys. In the renal basement membrane. And elicit a destructive inflammatory response of the glomeruli of the kidney. فيعمل inflammation في الكدني. 95% of the patients caused by this acute glomerulonephritis بيحصل لهم recovery by self-limiting يعني it is a self-limiting disease وبيحصل recovery alone من غير أي علاج without any treatment. ولكن 5% develop chronic or even fatal acute glomerulonephritis. Symptoms, of course, there is dysfunction in the function of the kidneys. فيحصل edema of the face due to the retention of fluid. بيحصل fluid retention. بيحصل edema in the face, in the abdomen, and in the legs. بيحصل uremia, يعني blood appears in the urine. Proteinuria, يعني protein appears in the urine, and this manifests itself. ده بيظهر على شكل إن urination لما الشخص يعمل urination urine comes out with froth. يبقى frothy. يعمل رغاوي. Azotemia, sorry. This is high nitrogen in the blood and also cause hypertension. ارتفاع في ضغط الدم. Laboratory diagnosis. هنا we look after the titer of antibodies to DNAs, NADAs, and hyaluronidase are typically high. يبقى هنا بنعتمد على these enzymes, not the anti-streptolizin O. As we said, these enzymes are responsible for the skin infections. The treatment, antibiotics doesn't prevent development or even treat acute glomerulonephritis once it has begun. ولكن otherwise البيشنت المفروض يعمل ايه؟ will need antihypertensive medication, diuretics to control the swelling. And by this we end. خلصنا المحاضرة الثالثة. Thank you for listening وإن شاء الله نتقابل next lecture إن شاء الله.